Thank you very much, Senator. Senator Niall. You know, I'd say you'll have to condense it, Senator. You've only 4 minutes.
Oh, don't you worry about that. I'll make my way through it, last Carly. And I'm acutely aware that there are members who are much more familiar with the issues of this matter than myself, Minister. But I do think it's very important to take the opportunity to comment on it, given the severity and the passion involved, as has been articulated previously. The National Rehabilitation Hospital provides complex specialist rehabilitation services to patients who, as a result of an accident, illness or injury, have acquired a physical or cognitive disability and who require specialist medical attention. It provides comprehensive inpatient and outpatient services to adults and children. And backed by over 50 years' experience, clinical expertise and a solid reputation for excellence, patients are given every opportunity to meet their rehabilitation goals through personalised treatment plans delivered by the interdisciplinary teams at the hospital. It's the only facility of its kind in the state. It operates on the ethos of providing high-quality care and treatment to patients on the basis of clinical need. It's a registered charity and fundraises to deliver its much-needed services as well. Brain trauma requires intensive and, in some cases, prolonged attention. In order to nurse people severely damaged back to full health, or as close as can be, adequate resources are required. We all know that there is a general crisis in the health service. There is less awareness that there is a specific crisis at the rehabilitation hospital. The big concern at the moment for the hospital is bed capacity, as has been said, in order to cater for the increasing number of people in need of its special treatment. As I speak, there are 283 people on the waiting list. Last September, there was 236 people waiting for a bed. In 9 months, nearly 50 people have joined the bed queue. In 9 months' time, what will the figure be? We don't know, but we certainly can speculate that it will go up. At the minute, 19 children are awaiting a bed. 50 people are waiting for brain injury treatment. For these patients, this is an emergency situation. Given the size of the waiting list at the rehabilitation hospital, it's obvious that the government's policies are failing people in distress. So, Minister, I have a number of questions for you, and some of them have been asked already, but they're worth repeating. What practical steps are being taken now to reduce the waiting list? Do you intend to recruit extra staff? And will you listen to the frontline staff, nurses, doctors and other healthcare professionals whose exceptional dedication absorbs so much of the hidden pressures that underfunding causes? It's quite clear that additional tailored funding is required for the rehabilitation hospital. And how many empty beds are there currently in the hospital? A new rehabilitation hospital is due to open in 2020, and even before its doors are open, there are worrying signs of bed capacity. Its bed capacity, 120, is similar to the current hospital. So a new hospital is needed and indeed welcome, but no new ideas from government on how to bring an end to the waiting list. So what does the Minister intend to do with the current hospital? Will it continue as a rehabilitation hospital to provide extra beds? The consequences for the rehabilitation of people in these circumstances is very worrying indeed. The Neurological Alliance of Ireland is running a We Need Our Heads Examined campaign, which is calling for investment in rehab services for people with neurological problems. So I would urge the Minister to examine his head and to listen to those who know what needs to be done to ensure that the crisis in the rehab hospital is resolved to the satisfaction of those most in need, and that's those on the waiting list.
Thank you very much, Senator.